Did you see Conrad Murray when he came into your pharmacy that day?
Yes, I did.
Do you see him here in the courtroom today?
Yes, I do.
Would you please point to him and describe for me what clothing he's presently wearing?
Wearing a lavender shirt with purple tie and black suit.
Pointing to and identifying Dr. Murray, the defendant.
Thank you. Mr. Lopez, when you spoke with or met with Conrad Murray, did you obtain information from him regarding his medical credentialing and authorization to purchase substances?
I did that. I don't remember if I did it then, but I did it at some point during the ordering process.
When you spoke with Dr. Murray concerning this information, did he provide you with his full name and the address of his medical office?
Yes, he did.
Was that medical office address provided to you located in Las Vegas, Nevada?
Yes.
Did Dr. Murray provide you with the information concerning his state of Nevada medical license?
Yes.
Did he also provide you with a DEA license number?
Yes, he did.
What is a DEA license number and why is it important?
The registration with the Drug Enforcement Agency and any facility and or prescriber who wishes to procure controlled drugs needs to have that particular number.
Would the Benequin qualify as a controlled drug?
No.
Would it be accurate to describe the DEA license as the appropriate verification or authorization for a person to order controlled substances from you?
We, pharmacists, use that number. That's kind of our check number that we use when a physician orders anything. And for several reasons, if you're working in a retail environment where you're billing insurance, it's a necessary number. And obviously, if you're ordering narcotic, it's a necessary number. But we just use it. It's our, for lack of a better word, it's our habit to always ask for that number from a doctor or any prescriber.
And Conrad Murray provided you with that information, correct?
Yes.
Did you also verify that his medical license was active?
Yes.
Did you verify that his medical license was unrestricted at the time that you did business with him?
I ask it in a nonchalant way of, I don't directly come out and ask him, but I do ask every person who prescribes from my place their status in a delicate way.
So you asked Conrad Murray himself regarding any restrictions or any issues related to his ability to procure medications from you. Is that accurate?
Yes.
And he provided you with satisfactory information such that you were able to establish a business relationship with him, correct?
Yes.
You told us that Conrad Murray described for you a particular patients who would be utilizing the Benequin cream due to a condition known as vitiligo, correct?
Yes.
What is vitiligo?
I don't know the exact nature. I know it's a condition that it causes whitening of the skin.
Would it be necessary for you to know the name of the specific patient anytime a physician comes in and places an order for you, as Dr. Murray did for this Benequin cream?
In this instance, since it was a trial basis and he was a doctor administering it directly to the patient, it's not necessary. But when it came to a point where he believed that the patient could benefit long-term use, then I would have to know who the patient was.
And why is that?
Because the patient would be less under his direct control. They would be taking the drug home, using it for long-term, but if he's, in this instance, he was using it as a sample to see, I guess, the consistency of it. You're not going to see a result overnight using this cream, but it takes some time. But I can only guess that he was using it to...
The objection sustained. Everything starting with, I can only guess, and thereafter is stricken. Disregard that portion of the answer. The first part remains.
Mr. Lopez, In most instances, do you know the identity of a specific patient who's going to receive medications when a physician comes in and places an order?
Yes.
I'd like to focus now on the later orders placed by Conrad Murray to Applied Pharmacy Services. When Conrad Murray completed the purchase of the Benequin and he picked it up, did you also speak to him at that point or shortly thereafter concerning other medications that he was interested in?
When he came to pick it up, I believe we discussed the possibility of delivering it to his office, any future orders, because I guess it was difficult. The timing was the time we closed, the time he got off his work. It was difficult for him to come pick him up himself.
What type of arrangements were made so that items could be delivered should that be his request?
I told him that any future items we can send a courier to his office.
Did you also discuss with him prepayment or a credit card payment that would be necessary in order for you to fulfill orders on a delivery basis?
Yes, I told him our normal practice was to have a credit card on file.
And did Conrad Murray provide you with credit card information to essentially set up a credit account at your business?
Yes, he did.
So when Conrad Murray came to your business and picked up the Benequin cream, is at that point that he inquired about future orders and could they be delivered to his office, correct?
Correct.
I'd like to move now to April 3rd of 2009. Mr. Lopez, did you have a follow-up call from Dr. Murray concerning the Benequin cream?
Yes, I did.
And what did Dr. Murray say to you during that follow-up phone call?
He was happy with the way the product turned out.
Did Conrad Murray ask you about any other supplies that may be available for his ordering?
He asked me if the pharmacy was able to order other things for his office use at the various offices that he worked at.
Did he give you specific examples of products or medications that he was interested in?
He asked me specifically to find pricing and availability of propofol and normal saline IV bags.
Now let's start first with the normal saline IV bags. Would that be a product that you regularly sell to physicians through your pharmacy?
Yes.
Now, propofol, is that a product that you have sold or provided through your pharmacy prior to it being inquired by Conrad Murray?
To the best of my knowledge, no.
Did you ask Conrad Murray regarding information about propofol in terms of strengths, quantity, sizing?
He provided that information and wanted me to find out what the cost would be for him. First, to see if I could provide it, and secondly, to see what the cost would be for me to provide it to him.
Did he tell you that he wanted certain sizes? For example, the size of the vial of propofol. I'm sorry, go ahead.
He wanted the 100 ml volume size, and he wanted the 20 ml volume size.
So at the first instance when Dr. Murray is inquiring about propofol, he provides you the information of the size of the product that he wants you to provide him information on. Is that accurate?
Yes.
And did you follow through with Dr. Murray's request and check on the prices?
Yes.
Were you able to find out that information?
Yes.
What did you do after you obtained the information that Conrad Murray had requested?
Gave him the information.
And that would be pricing and availability?
Yes.
And once you advised Conrad Murray of the pricing and availability, did he make any requests at that point in time?
He placed an order.
Would that order have been placed on or about April 6th of 2009?
Yes.
Did Conrad Murray place the order in person or on the phone?
On the phone.
And he placed it with you?
Yes.
Your Honor, I have two documents. The first is an applied pharmacy receipt dated April 6th, 2009. May it be marked People 64, please?
Yes.
And the next document is a FedEx shipping receipt dated 4/7/2009. May it be marked People 65, please?
Yes.
Mr. Lopez, please take a look at, thank you, People's 64 that I've placed on the projector. Do you recognize this document?
Yes, it's a financial receipt from Applied Pharmacy Services.
To the right of you, there is a laser pointer. Would you walk us through the information that's contained on your applied pharmacy receipt as depicted in Exhibit 64, please?
This is obviously the name of the company, our address, date it was generated, invoice number that's generated. This is a QuickBooks software, so this is the number that it generates.
And that date is 4/6/2009, correct?
Yes.
And then the next box to the left?
This is, we reserve this for the purchaser and the billing address.
And the purchaser in this instance is Conrad Murray, MD, Global Cardiovascular Associates, with an address on Flamingo Road in Las Vegas, Nevada. Is that correct?
Correct.
Now let's move down to the body of the invoice. Are you able to see that clearly from where you are?
Yes.
Mr. Lopez, would you describe for us each of the items that were purchased by Conrad Murray as contained in this applied pharmacy receipt dated April 6, 2009?
This describes the quantity of the drug or the item, and this is a description of what the item is. So on the first line, in this instance, it's propofol comes in 10 vials of 100 milliliters of a strength of 10 milligrams per ml, and one tray of 10 individual vials was ordered of that particular volume. The second line, same thing, the difference is the volume of each vial. So one tray of 25 vials at 20 ml volume was ordered.
Let me stop you there for a second. So the first propofol order, would that be accurately described as a small vial of propofol?
It's
There's two sizes of propofol
Yes.
vials reflected on this invoice, correct?
right. The
And
first,
I'm sorry, and that would be the first two items that are in the description box, correct?
yes,
Do those propofol items represent two different sizes of the product?
yes.
Which is bigger, which is smaller?
The first one is larger volume. The second one is smaller volume.
And in the first propofol, you indicated that that contains a total quantity of how many vials?
10 vials.
I'm sorry?
10 vials.
And then the second item of propofol contains how many individual vials?
25 vials.
Thank you. And the next line? What was the product that was also purchased there?
Next line is a reorder of the first item that Dr. Murray ordered from us, which is the Benequin 20% cream, 40 tubes of 30 grams each.
And the last item?
Normal saline IV bags, 9 of them. Each bag is 1,000 milliliters.